Hello, I'm Dr. Apurva. I'm a fellow at GSR Hospital, Hyderabad. The director of our hospital is Professor Dr. Srinivas Gosla Reddy, sir. He's a craniomaxillofacial and facial plastic surgeon. We focus mostly on clefts and any facial differences or facial abnormalities. There are extremely varied reasons for clefts. It's all multifactorial. There's no single reason which has been pinpointed for why clefts occur. So we just say that all the structures that are needed in your body or all the body parts, they are just there. The only thing is that they are not joined. So it's all nature or God or whatever you want to believe it in. So we have to join the parts together. So that's what we do in cleft surgeries. Now, coming on to the treatment of clefts, we take care of a child from when it's born, or sometimes even now, even before it's born, as mostly in scans, the parents get to know whether the child has a cleft. So once they get to know, they come to us, we counsel the parents, we tell them all about the treatment planning, and we mentally, emotionally, as well as physically prepare the parents to take care of the child. We always assure the parents that the child is very much normal. The only thing is that they have some structures which are not joined together, and all we have to do is join them. So the surgery for a cleft is not something which happens overnight. It's not a one-step thing. It's a process which involves multiple steps. As soon as the child is born, we first make sure that the child has been stabilized. Then, within 4 to 5 days of birth, we bring the child to the hospital. We check the child's condition, and if it's ready, we generally do something called a lip taping, in which a tape as well as a plate is put on the child's face so that the cleft segments can come close towards together and they can be closed better in a surgical fashion. This all happens when the child is about 4 months of age and more than 5.5 kgs of weight. We first proceed with the very first surgery, which is called primary kiloplasty or lip surgery. After the lip surgery is done, at around 1 year of age and more than 8.5 kgs of weight, we do primary palatoplasty or closing of the cleft palate. Then, when the child is around 3.5 years old, we start speech therapy. Speech therapy is nothing but exercising the muscles of the palate so that the child's voice, speech, pronunciation as well as enunciation is much more clearer. Then this speech therapy will proceed until the child is about 6 years of age. At 7 to 8 years of age, we again assess the child in something called VPI assessment, or basically secondary surgery for speech. If it's needed, we do that, otherwise we don't. At around 8 years of age, we go with the alveolar bone grafting. There's a cleft which is also present in the alveolus, or the bone that has the teeth in it. So we just graft some bone from the hips and put it in the cleft alveolus so as to align the arches and to also help the teeth come in a more straight and correct fashion. At around 12 years of age, our child is ready for orthodontics, where we use braces and we put them on the teeth to bring them closer together and to close the gap. And then the child is around 15 years of old, we do something called jaw surgery, in which the upper and lower jaws are balanced together. Finally, the last major procedure that a cleft child has to undergo in their life is called a rhinoplasty or a nose surgery, in which the nose which has been deformed due to the cleft is corrected, straightened, and sharpened. If the child is a boy, he can go for a hair transplant in the region of the scarring of the cleft so as to hide the scar. Whereas if the child is a girl, she can definitely go for something called permanent makeup or permanent tattooing, in which we use an ink which is similar in color to the color of the patient's skin, and we just hide the scar. They can also undergo additional dental rehabilitation if needed in the future. And that's all there is to a cleft. So it's not a mental disease or a physical disease or a burden on the child. We should celebrate the child just as if they were normal. Clefts are something which are entirely treatable. It's a standard and routine procedure. So if you have any questions regarding clefts or any other facial differences, please feel free to ask the questions in the comments below or call us on our contact number. Thank you.